of losing right now. We'll lose part of our capacity to preserve and understand and appreciate the American soul and the American experience. Rural America is in crisis, and the rural hospitals are absolutely critical for them surviving these crises. These institutions are not just medical providers. They're, in most cases, they're the single largest employer in those areas. They have the highest paying jobs. And when they lose them, as we talked about before, it's not just the hospital that closes, it's the pharmacy that closes, it's the stores that close, and the community collapses. So we have to, and President Trump understands this, preserve these rural hospitals, and they were closing at an epidemic rate. And that's why he put in the big, beautiful bill, the Rural Transformation Program. And I'll talk just a little bit about what that will do. Right now, we send about 7%, 6 to 7% of Medicaid dollars to rural hospitals. And that's about a total of $19 billion a year. So they're already getting shortcut. It's a very, very small sliver of what Medicaid pays out goes to these institutions in rural areas. President Trump's big, beautiful bill is going to give $50 billion over 5 years. So that's an infusion of $10 billion a year. That's an over 50% rise in the amount of federal dollars that is now flowing into rural areas. Oh, this bill has the capacity to save these rural hospitals, to give them a chance to stabilize themselves, to right the ship, and then to adopt innovation and workforce changes so that they can survive for the decades into the future. The money, as Governor Abbott pointed out, the first $25 billion of that is going to be distributed evenly to the 50 states. The second $25 billion is going to be distributed based upon a number of metrics, but particularly the quality of the applications. We want to see money spent on infrastructure. We want to see it spent particularly on innovation, adopting telehealth and AI in rural communities. We want to see it spent on workforce quality and quantity improvement, which is another staffing crisis that rural hospitals face. And we want it spent on, we want to see proposals that will emphasize holistic care, preventative care, value-based care, and physical health, exercise, food, these kind of things, and rebuilding the infrastructure of these facilities so that they can last for generations. The applications are coming out, the deadline is coming very, very quickly. And so we met with the rural health providers today, and we encouraged them to cooperate. We didn't really have to encourage them because they already have extraordinary cooperative relationships with each other. They came up during our meeting with a series of ideas that every one of them, from a personal point of view, I wanted to fund. As they're the kind of ideas that could propagate and spread, and that were very, very thoughtfully crafted, and we'd like to see those kind of things adopted throughout the country. I think you have an extraordinary quality of leadership in these rural health care in this state, and I'm very confident that the application is going to be a stellar one. One of the things that I talked about with Governor Abbott is that part of the score is going to be how well the state has done at adopting kind of MAHA legislation. And Texas now leads the country, so I think they're going to do very, very well in their application. The decisions will be made by December 1st. We will evaluate all the applications, and then the money will be distributed starting in January. And so I've encouraged Governor Abbott and these wonderful leaders behind me to work as hard as they can to come up with the most innovative solution. I want to say one other thing that is going to benefit rural hospitals in this country. President Trump has signed an executive order that requires, when we at HHS or the other federal agencies want to adopt a new regulation, we first have to get rid of 10 existing regulations. And the rural hospitals are very, very badly overregulated, and it's one of the reasons they have very high costs. We've encouraged the people in this room to provide us regulations that are impediments to them providing good care to their patients, and we will do everything we can to get rid of those regulations, to untie their hands, to allow innovation to flourish, to turn every county in Texas into a laboratory for healthcare innovation. And let's get in the AI and the telehealth and all of these entrepreneurial changes that we can have when you have such a brilliant, thoughtful, and imaginative leadership in the state. Thank you.
Thank you very much. We'll take a few questions.
Secretary Kennedy, thank you for being here. How can you ensure that the CDC can continue to operate effectively in light of these recent resignations?
If I could just say one thing, I know he'll be happy to answer that in a second. If we could stay on topic first. Thank you for not wasting any time getting off topic. Let's. I know we're going to come back to you. But
Secretary, can I have a question for both you and the Secretary? What do you say, you're talking about a December 1st deadline, what do you say to the pregnant woman in Fayette County right now, or the cancer patient in Lanham County right now, about keeping their health care options available?
Well, I think the big beautiful bill, the money. That's why we want to get money out the door as quickly as possible. This is an unprecedented fast pace, and the reason that we're addressing this with such rapidity, which puts a huge burden on my agency and the federal government to make these decisions, is because we understand the dire need that people in rural areas are now suffering, and we want to get them that money as quickly as we can.
Also, in the legislation that we signed in the regular session, there was about $300 million that went to address healthcare needs like that in rural regions in the state of Texas.
Secretary, I have a question for you. So you talked about telehealth being a solution for families in rural communities that have, many areas in Texas are designated behavioral health workforce shortage area. And so while you're saying telehealth is a solution, if you don't have the staffing across the state to address the needs of families, where do we go from here? How are we going to address the staffing issues to make sure that families in crisis can connect with someone even through telehealth? And is there a plan in place to sustain a 90-day crisis lifeline so that people can have a direct source of support? And is there another plan that's out there that's it's important to me to know that that resource follows all the way through to a person in need?
Sure. So we can both try that. So for one, you're mentioning a couple of things. One is the availability of telehealth. We realize that's possible in some ways, not possible in other ways. We've got to find ways to expand that. Staffing is another crisis point issue that we're working to address, whether it be on mental health related issues or non-mental health based issues. But through the telehealth, that's one way in which we can actually expand access to staffing without them being there in person, but through the telehealth approach.
Two more questions.
All right.
Secretary Kennedy, that's Karen Paul with CBS News. Thanks for being with us today. My question is, in speaking of rural Texas, we know places like Uvalde have experienced one of the worst mass shootings in history. The CDC has previously been responsible for studying gun violence. A lot of those programs have been cut now. Would you still consider gun violence a public health crisis? And who's going to be...
I certainly consider mass shootings a health crisis, and we are doing for the first time real studies to find out what the etiology of that is. And we're looking for the first time at psychiatric drugs. You know, these kind of mass shooting, people have had guns in this country forever. When I was a kid, we had shooting clubs at our school. People, kids, my classmates, other people, would bring a .22 rifle with their guns to school and park it in the parking lot. Nobody was shooting, so there's never been a time in America, in the history of humanity, and people walked into a crowd, into a church or a movie theater or a school or a crowd of strangers and just started randomly shooting. It's happening in our country. It's not happening around the world. And there are many other countries that have comparable levels of guns that we have in this country. We had comparable levels in the 40s, 50s, and 60s, and people weren't doing that. Something changed, and it dramatically changed human behavior. And one of the culprits we need to examine is whether the fact that we are the most over-medicated nation in the world, and that a lot of those are psychiatric drugs that have black box warnings on them that warn of suicidal and homicidal ideation. So we are doing those studies right now for the first time, and we will have an answer.
Last question.
About the CDC, about this.
Hold a second. He opened with that. He gets to go back to it.
Thank you, Governor. My question was, in light of the recent resignations of the CDC, how are you ensuring that that agency is able to do its job effectively?
I would say this, that first of all, I will confirm that we let go Susan Menares yesterday. I'm not going to talk about personnel issues, but the CDC is an agency that is very troubled for a very long time, and anybody who lived through the COVID pandemic and saw all of these bizarre recommendations that were not science-based, all the misinformation, understands that the CDC has on its website today that among the top 10 medical innovations, greatest medical accomplishments in history was abortion. This is one of the greatest medical accomplishments because it keeps small families. Go to the website and look at it. Fluoridation, giving kids a toxin, and vaccines. So there's a lot of trouble at CDC, and it's going to require getting rid of some people over the long term in order for us to change the institutional culture and bring back pride and self-esteem and make that agency the stellar agency that it's always been. I'm very confident in the political staff that we have down there now that they're going to be able to accomplish that and ensure the competent functionality of that agency.
That's it. That's all we got time for. That's all we got time for. No, that's all we got time for. Thank you. Thank you, guys.